Hello friends, it's a pleasure to have you back on the channel of Clinical Care Insights. Today we are going to discuss about one of the most interesting as well as the most challenging disease in the psychiatry, and that disease is called as the attention deficit hyperactivity disorder. In short, it is also called as the ADHD. Got it? No problem. So before I am going in depth of our today's lecture series, I am going to tell you something. In the life, there are so many things happening on the way. Okay, as we are, you can say, pursuing our goals, as we are taking the steps towards our goal, we feel a lot of disturbance. But you know what? You have to, you can say, strongly catch in your mind or strongly hold in your personality is that you always have to believe in yourself and in your dream. That is the only one remedy you have, because if you lack belief on yourself, okay, if you lack belief in your goals, okay, your imaginations, then you will be slowly losing your vital capacity. We don't know how much capacity as a humans we have. We don't know. Okay, you know that same person, take the example of the Einstein, okay, take the example of the Swami Vivekananda, and there are many more persons. Okay, they all are essentially a human, but how they are so, you can say, the intelligent, so you can say the impressive person in their time. Why? Is anything unique in them? Yes, and that unique thing is the self-belief. Okay, if you hold your self-belief strongly, tightly, that you come in this world to achieve something, to do something, you will definitely do in one day. Okay, one day you will achieve your goals, you will achieve your target. The things only you have to keep in yourself, keep in your personality, keep in mind is that you never ever lose your own self-belief system. Okay, so self-belief is a very vital thing you always keep, and I myself suggesting, I am also take caring. Okay, fine. So let's make today's discussions like very interesting way. Fine. So first I am going to orient you what things we are going to discuss about this attention deficit hyperactivity disorder. First, we will take a glimpse of about their introduction, that what actually this attention deficit hyperactivity disorder is. Then we will discuss about their type, their symptomatology, means their symptoms, how these patients look like, what are their behavioral problem. Actually, this is a psychiatric problem, so it must have certain underlying disturbance in their behavior. Okay, so we will discuss that. Then we will also discuss about the etiology, okay, the cause basically, and their neurobiological pathophysiology, that what is actually happening with these ADHD patients. Okay, the things will also, of course, it will happen in their brain, isn't it? It will happen in their brain only. So we will see their neurobiology. Okay, we will also discuss the management, that once we know that this is the mechanism why this is happening in a person, in a patient, then how can we manage that? Okay, so we will manage that by the drugs as well as by the certain therapies. So we will discuss under the heading of the management. So let's start with the introduction. Okay, so first you pay the attention here. What is attention deficient hyperactivity disorder? Here mark the words. Okay, mark the words. The first word is called attention. Okay, then the deficient means attention is lacking. Okay, hyperactivity means there is no any normal activity. What is our normal activity? Normal activity is speaking, okay, walking, fine, and also we are writing, eating, sleeping, and other tasks. But these tasks are pleasant to us, these tasks are smooth to us, okay, and also to the society, isn't it? Then these you can say behavior or this kind of, you can say, activity is called as the normal activity. But what happened in this case, there is a hyperactivity, means this activity not only disturb the patient, the person who are doing, it also disturb the society. Okay, it's also disturb the society. So one is the hyperactivity and disorder. So again, attention means there is attention deficient, the patient is not able to focus well, not able to concentrate well on their day-to-day tasks. Okay, or you can say they are not able to focus on other person's, you can say, perspective, their idea, what they are saying, fine, and along with that there will be a hyperactivity in there you can say the personality in their work, and you know that if that is a hyperactivity, then it is not considered as a normal, this is abnormal, so this is called as the disorder. Are you getting my point? So in short, we start with the introduction. My handwriting is like bit, you know, like थोड़ा सा हिला हुआ है, so better to manage with it. Okay, you can suggest me, I will try to improve. I am improving day by day. So now let's start with the introduction. As we discussed that this is a basically disease of what? It's a disease of the brain. So basically ADHD, attention deficit hyperactivity disorder, is basically what? It is a psychiatric disease. It is a psychiatric disease, or you can say the disorder. No problem. Now this, you know that what happened actually, there are specificity related with the disease occurrence, isn't it? Means that one particular kind of disease is targeting a one age group, okay, another category of disease targeting the another age group. Are you getting my point? One category of disease specifically targeting the male, another category of disease specifically targeting the female. Okay, so disease have their specificity, although the diseases are not a good for us, not a good for anyone, fine, but they holding the specificity. Okay, specificity is linked with the diseases. So these diseases specifically, or you can say the particularly targeting the two, you can say the age group people. The one is children's, unfortunately, and also it's also affect the adult. It also affect the adult. Now, the thing which you have to keep in your mind is that this disease is, you know that when the history start about this disease, when we go back to the 90s, 1904, or you can say the 1943, okay, these diseases are, you can say, specifically or particularly considered that this disease occurs only in the children. This disease occurs only in the children. But nowadays, I don't know why, but there are so many, you can say, the hypotheses, so many saying, and one of that is that due to the social media, due to the use of the multiple apps, the multiple streams activity, the online activity, it's all lead to the problem in the adult also, this problem in adult also. Initially, this disease is only, you can say, linked in the children, or this disease is only found in the children when this disease is discovered. But nowadays, in the present scenario, what is happening due to the digitalization, okay, or you can say due to the adaptation of the machines, okay, the adults also become prone towards this disease, means adults is also suffering from this disease. Are you getting the points? So particularly initially it is only restricted to the children, but now it is also seen in the adolescents as well as in the adult. Are you getting my points? And mainly what is happening, this disease is started in their early, you can say the 16s, okay, in their early 16, it's below the, you can say the 16 years, it's started, this disease is started. And if you not manage the disease, if this disease is not managed, not treated well, then it will also, you can say, go along the way, and it is also present in the adulthood, okay. And if this disease is not managed, then it lead to the two, you can say, negative outcome. You know what is happening, not related with the disease specifically, all the psychiatric disease, if you not manage that disease, if you not, first you have to diagnose, okay, that which kind of disease it is. So first you have to diagnose. Once you diagnose the disease, fine, then your second motive, okay, you can say the physician's second motive is to immediately try to suppress the symptom, okay, or if possible then cure the disease permanently. Are you getting my point? So if this disease is not managed initially, not identified initially in the children, it lead to the two negative outcomes. Okay, this disease lead to the two negative outcomes. The one is called as the conductive disorder. Okay, and another one is called as the antisocial personality disorder. Okay, antisocial personality disorder means initially if this disease is managed, then there will be no any further problem. Okay, there is no any further problem. And as I studied, and as the most of the research shows, that there is something called the reoccurrence and re-meeting. Means once you cure the disease, fine, then again after some years, or after due to the, you can say, again any trauma, that disease appear in a person. That is called as the remitting, okay, or relapsing. Fine, relapsing or remitting. Got it? But due to, in the case of ADHD, the relapsing, or you can say the remitting phenomenon is, you can say, not well, or you can say not well established. Means this is not well present. Fine. So there is a very poor chances to again you can say come this disease in a patient. Fine. There is a very poor chances. Now, but if we not manage, then end up with these two severe diseases. The one is called as the conductive disorder. Okay, another one is called as the antisocial personality disorder. So typically this conductive disorder, okay, this conductive disorder, it is occurring in the children's. Okay, and this antisocial personality disorder, this is occurring in the 18 plus, means adults. Okay, this 18 plus means adults, and this is occurring in the children. But both the diseases are, you can say, a very bizarre condition. Means a person who is suffering from this conductive disorder, fine, they will not obey the rules, okay, the societal norms. They will not you can say obey the rules. They will not follow any kind of societal you can say societal commands, rules and regulations. They will not follow. Fine. In the also the anti-personality disorder, here the persons become, you can say, also not obeying the rules. They are breaking the rules. Fine. Also they will not you can say, and they will not do their day-to-day activity. Means there will be a problem in their, you can say, tax management, in their own tasks. Okay, they are, you can say, very obsessed kind of person. Fine. Also they will make the fight. Okay, they will not treat animal well. Okay, they beat the animals. Are you getting my points? They start saying too much lie. Okay, apart from that they will also you can say start abusing the drugs. Okay, abusing the alcoholism condition is also identified. The alcoholic patients, okay, in the late stage, this disease also appear, called as the antisocial personality disorder. Means they will not follow the society. Now it's surprising, and it's not surprising actually, but sometimes what happens, like there are peoples, okay, there are well educated peoples who not obey the societal rules. They have their own rule and regulation. But remember, those rule and regulation which is set by a person, okay, that not disturb the society, that is for their own well-being. Fine. But here what is happening, they also have their own rule and regulation, but that rule and regulation is not aligned with the societal rule and regulation. Means they disturb the society rules and regulation. Fine. Are you getting my points? Means they start the thieving, okay, they start the gambling, they start, you can say lying too much, they start brutally behavior, they start beating the animals. Fine. These are the antisocial personality disorder. Just we are saying that they are not following the society. I mean, the normal person can also not follow the society, but yeah, they are not following the society internally, but outward they are saying they are, you can say, they have the smooth relationship with the society. But here what is happening, that the relationship is not a smooth. Okay, relationship is not a smooth. Fine, no problem. So that is a negative outcome of ADHD. Now, once we discussed about the ADHD negative, the prevalence, okay, the occurrence in the children and adults, we also discussed about the ADHD is a psychiatric condition. Now, this ADHD, they are initially also called as the minimal brain dysfunction. Write it down. It can be asked in the MCQ. It is called as the minimal dysfunction of brain, or simply you can write it brain. Now what it means? It means that the brain functions, okay, is diminished little bit. Fine. Initially, when this disease is started to recognize that, okay, this kind of symptoms which we discussed is a kind of a disease condition, on that very moment this disease is termed as the minimal dysfunction. You can say minimal dysfunction of the brain, means there is a very poor neurological coordination. There is a poor neurological coordination in terms of the attention, fine, in terms of the impulsivity, fine, in terms of the hyperactivity. Means there will be a problem in behavior, cognitive decline, but that are the minimal range, okay, that are in a minimal range. But later on, you know, the DCM4, this is basically a body, okay, this is an organization which classify the disease, okay. So later on, this minimal dysfunctions of the brain is called as the ADD, attention deficit disorder, okay, attention deficit disorder. But now in the DCM5, remember this DCM5 is a body or organization which classify the mental diseases. So in the DCM5, in the DCM4 and also in the 5, okay, the ADD is now, it is considered as the ADHD, attention deficit hyperactivity disorder, ADHD. Okay, this is about their historical aspect. No problem. Now, what do you think? Is this disease is inheritable? Yeah. If you suppose a person's, suppose your father have this ADHD, is there any chances to this disease inherited in you? Yeah, of course. My friends, in terms of psychiatry, it is the one of the most heritable disease. Write it down. In terms of psychiatry, in terms of, you can, in respect to the psychiatric diseases, this ADHD is one of the most heritable psychiatric condition, most heritable. So there is a, yeah, genetic relation, okay. So it is the most heritable disease, fine. So if someone's father have this ADHD, okay, then there is a chances to that disease will be passed into their next generation. And if they have the twins baby, if their father have the twins baby, then there will be a more higher chances, okay, to occur this ADHD in both the children, in their both the child or both the children. This is called as the concordance of this ADHD. Are you getting my point? So monozygotic twins have the higher chances, you can say the higher rate to inherit this disease, okay. So there is a genetic relations, and apart from that, if you're talking about the causes, the other causes, then other causes of the hyper deficit, you can say the attention deficit hyperactivity disorder is the paper says that there is a risk factor for the smoking, okay, certain viral diseases. Apart from that, there are, you can say, you know that one thing, there is a something called substance use, okay, substance use. So if a person, if a child have the access in their early life towards this some certain narcotic drugs, or you can say the certain substance abuse, okay, or if someone intensely give the drugs to the child, and after you can say some days, if that drug dose is withdrawal from that child, then also child have this kind of problem called the attention deficit hyperactivity disorder, fine. So these are the certain causes. Once again, we will just quickly recap what we studied. We studied that attention deficit hyperactivity disorder, or in short it is called as the ADHD, is basically a psychiatric disease, okay, and it is most commonly seen in the below 60s children. And nowadays, due to the modernization, you can say due to the digitalization, due to the excessive use of social media, less sleep, fine, adults are also suffering, okay, adults are also suffering. This is one of the most inheritable disease in terms of in terms of psychiatric diseases. Okay, it's one of the most inheritable disease. Apart from that, this ADHD is initially called as the minimal dysfunction of the brain, because initially there will be a less disturbance in their, you can say, the neuropsychological circuits. But this DSM-4 recognized this disease later on as a ADD, attention deficit disorder. Then again it is renamed as a ADHD. Got it? No problem. And if this disease is not managed in the early, then later on this disease is end up with the two severe condition. One is called as the conductive disease, which is in the children, and another one is the antisocial personality disorder. No problem. Now, once we have the little idea about this ADHD, now let's move to the symptomatology. Okay, because one thing I want to specifically quote here is that this disease, if you're talking about the diagnosis, how to find out this disease is occurring in someone, then there is no any specific lab criteria. Okay, there is no any specific imaging technique. You know that basically in the case of the brain diseases or in any other psychiatric conditions, generally we prefer certain imaging techniques like the CT scan, MRI, PET, PCTT. Are you getting my points? But in this disease, there is no any you can say the actual golden state diagnostics tools. No. So how this person is, you can say, diagnosed? These patients are diagnosed. They are diagnosed with their symptomatology. So when I am going to describe the symptoms, we have to really pay your proper attention. Remember, this is a disease, okay, which basically affect the attention. No problem.